and we'll continue with our presentations and with hearing from our state government. Ms. LaQuana Palmer will talk to us about North Carolina Care 360, COVID-19 response and recovery. LaQuana is a program manager in the Healthy Opportunities Office of the Secretary in the North Carolina Department of Health and Human Services. LaQuana.
Hi, good morning. Good morning, everyone. I'm just trying to pull up my my presentation for you all this morning. I thank you all for inviting me to be a part of the conversation. We're doing such great critical work right now as it relates to COVID response and recovery, and it's just great to hear the many voices this morning. My name is LaQuana Palmer. I am the program manager and the Office of Healthy Opportunities. It is an initiative that falls underneath the Office of the Secretary. This is some great work that we've been doing for, I would say, the last 2 to 3 years, and it's a new initiative. However, a lot of the work that has been done before this office was created was done already by so many, such as Dr. Michelle Laws and also Dr. Jesse Tenenbaum as well. So just wanted to first start off with thanking them for their work that they're already doing and have been doing prior to COVID to help us with linking so many people to the resources using NC Care 360. NC Care 360 is a part of the Healthy Opportunities Office with so many other initiatives that we have. Some of the things outside of that we're using to help with bridging health and healthcare human service programs. We have those things together in order to make sure that we are looking at those social needs in a community to ensure that individuals are connecting to different resources. We have our social determinants of health hotspot map that we're using. We have our screening questions that have developed, and hopefully we'll have guidelines that'll go with that soon. I'll talk more about NC Care 360 and the work we're doing with that. But we're also looking at Medicaid transformation and our pilots that are connected to that as well. And then Dr. Tenenbaum was able to talk about some of the work that we're doing with our workforce as far as looking at our community health workers. All of these different resources and all of these different initiatives work together again to bridge the health and human services together. So many times we've looked at both of those entities and seen that they've been fragmented, but we want to find a way in order to link them together. So NC Care 360, we're happy to announce that as of Monday, and even earlier than that, we announced it during a press briefing with our Secretary Cohen. She was able to share that we are now across all 100 counties in the state. We announced that proudly because it was originally planned to be rolled out at the end of this year. So we are typically, right now, we are 6 months ahead of time. So really, really excited about the work that we're doing with this network. It is the first statewide coordinated network that unites, again, healthcare and human service organizations with a shared technology platform, and it allows for coordinated, community-oriented, person-centered approach delivering care in North Carolina. NCDHHS does not do this work alone. We have the Foundation for Health Leadership and Innovation, who is our partner in this work, and we are also working with other implementation partners such as Unite Us, United Way 211, Expound, and so many other community partners to do this great work. We are excited about NC Care 360. Again, it is helping with that fragmented system that we have, with making sure that more of our community-based organizations and more of the people who have these needs, especially during COVID, are linking to those resources. So some of the key areas that NC Care 360 that we're really happy about is the fact that we have configurable and structured data. It is real-time reporting that is happening in this network. So a lot of times we are looking at different systems, but we have to use another mechanism to be able to find out exactly what is happening in our communities. Happily, with this network, we're able to look at our outcomes, performance, and efficiency right within that network. So if you look here on the screen, we have patient-level coordination and tracking, which looks at patient demographics, access points, service delivery history, and also outcomes. These key things are important because when we are looking at demographics as far as figuring out exactly what is happening in our communities and what is equity in our communities, or these resources, we're able to look at this information real time to see exactly what is happening. So whether we are looking at gender, age, race, ethnicity, so many different factors that are in there. We're able to, again, look at that real time to see exactly what is happening. We also are able to look at this information from a network level. So that means we're looking at transparency and accountability. So again, looking at the service episode histories, referrals that are created, also the structured patient outcomes. All of these things and this data is so critical because when we begin to put together and look at this data and we want to inform our policy, we're looking at planning. We're looking at investment mapping. We want to find better ways to address those unmet resource needs and to improve the quality of care over time. Dr. Laws has already previously shared in her presentation how critical it is to make sure that when we are pulling this data, that we're looking at not only where it is happening, but what communities are affecting our communities the most. So when we're looking at this data and we're working with our community-based organizations, no matter the size of the organization, we are able to help them providing that information so that when they are applying for grants, when they are looking for additional resources to provide in those communities, they have the data real time that they are able to use. It's been very critical to pull this data, especially as we are working with our historically marginalized populations, because again, we are working with some of these organizations who sometimes do not have the infrastructure in place to continuously bring in the resources or the funding that is needed in order to get these resources out to these populations. So it's critical for us to go in and work with these organizations to pull them onto NC Care 360 to ensure, one, that they are able to link our community members to the resources that are in need, but two, to make sure that they can continuously pull in the information that they need in order to keep those resources flowing. So again, this is a great announcement that we made this week as far as it being across all 100 counties. We hope to pull more organizations on so that we can continue to reach those communities that are historically marginalized populations. We're just really excited about this work. I thank you all for inviting me today, and I welcome any questions that you may have about NC Care 360.
Thank you very much, LaQuana, for sharing the exciting news. It's really encouraging to know that these things are happening at the state level. Can you tell us, like, what data, I guess, from the state government perspective, are you most eager to use the system to collect?
We're most eager to find out exactly what referrals are needed. So what resources are being asked for when those referrals are made. So whenever we are sending out a referral, we're able to connect with an organization that has specific, resources that are available. But we want to see exactly, what is the ethnicity, the race. We're looking for all of those different demographics to see exactly who is requesting those resources and those needs. So that's the information that we're really looking to pull, most especially as we're looking at COVID and we're looking at contact tracing and using community health workers in order to help with doing a lot of that tracing. So we're hoping to also use them while they're doing the tracing, that we're connecting them to resources as well. And then hopefully we can pull that information as we provide that work.
Great, thank you. And we have one more question, the audience. How were you able to so quickly escalate the full implementation across North Carolina?
I'm glad you asked that question. We do have implementation partners, and one of those partners, well, two of those partners that have been really working hard behind the scenes is NC 211 and also the Unite Us team. Our Unite Us team works with us, and not only do we have community engagement managers, but we also have data managers as well. And so using those data managers and community engagement managers and our navigators and so many other partners, we were able to rapidly expedite much of the work that needed to be done. Because of COVID, we were no longer able to do a lot of the in-person trainings. So a lot of that work went virtually. And when we were able to offer those trainings virtually, there were so many partners that reached out who wanted to be onboarded. And even with the announcement on Monday, we had even more organizations that reached out who wanted to be a part of this network. So with expediting, it was so critical. It was a lot of late nights and early mornings, but a lot of that work got done.
Wonderful. Thank you so much. This is really encouraging and exciting, and thank you for presenting and telling us about the great progress our state is making.